And experts are reporting a new type of COVID-19 in Da Nang, and the Deputy Prime Minister has emphasized the need to tighten their compliance on COVID-19 prevention control. Plus, an update on the COVID cases numbers. Joining us live from Vietnam is Chriselle Yacuna. Hello, Chriselle.
Hello, good afternoon to everybody who's watching.
Good afternoon.
Yes, let's report new type of COVID-19 in Da Nang. Preliminary epidemiological investigation showed that 4 out of 5 COVID-19 cases confirmed over the past weekend are linked to 3 hospitals in the central city of Da Nang. Deputy Prime Minister Vo Duc Dam, chairman of the National Steering Committee for COVID-19 Prevention and Control, presides over a meeting on COVID-19 this morning. The above news was released by experts at the meeting of the National Steering Committee for COVID-19 Prevention and Control this morning. These health facilities, as the experts at the meeting of the National Steering Committee for COVID-19 Prevention and Control, these facilities, as the experts said, are the Da Nang Hospital, Da Nang Hospital C, and Da Nang Orthopedic and Physical Rehabilitation Hospital. To prevent the spread of disease, experts suggested all people who return home from Da Nang and are linked to the aforesaid hospitals must be quarantined for 14 days, while health declaration must be mandatory for the others. Genome analysis showed that this is a new type of COVID-19, which is more infectious, said Acting Minister of Health Win Tang Long. The Ministry of Health has sent best experts to Da Nang to help the central city contain the outbreak and find out infection sources as soon as possible. Over the past weekend, 3 residents in Da Nang and 1 resident in Quang Nam were confirmed positive for COVID-19. Another update, Alma, Deputy Prime Minister urges hospitals to stay ready for COVID-19 treatment. Deputy Prime Minister Vo Duc Dam has emphasized the need to tighten the compliance with regulations on COVID-19 prevention and control, stating that all hospitals nationwide must be ready to combat the disease in their localities, as well as to provide aid for other localities when necessary. Deputy Prime Minister Dam, head of National Steering Committee for COVID-19, underlined the point during his virtual meeting with some relevant hospitals on July 28 concerning the treatment of COVID-19 patients. After listening to reports and opinions of experts and doctors, Deputy Prime Minister Dam asked for optimal concentration in the treatment work, while urging utmost efforts to ensure no fatal cases. And I quote, "We are not surprised by the situation of the COVID-19 outbreak in Da Nang, but in fighting the disease, we must always anticipate the bad situation, even the worst case scenario, to prevent it from happening," end quote. The Deputy Prime Minister asked the Ministry of Health to mobilize forces and testing technologies to detect infection sources of the pandemic as soon as possible. The entire hospital system must raise vigilance and fully and seriously implement regulations when receiving people who come for medical examination and treatment, including patient screening and classification, he requested. And last but not the least, Alma, 8 new COVID-19 infection cases confirmed. Total increases to 446. Vietnam has confirmed more 8 COVID-19 infection cases in the central city of Da Nang, raising the total number of COVID-19 patients in Vietnam to 446, according to the National Steering Committee for COVID-19 Prevention and Control on early Wednesday morning. Da Nang City has recorded 29 new COVID-19 infection cases over the recent 5 days. So far, that is the update from Vietnam, Alma.
Very much for your updates there in Vietnam. Thank you, Chriselle.
Thank you so much, Alma. Reporting live from Ho Chi Minh City, this is Chriselle Yacuna. We live in interesting times.